Hello, my name is Kamal Ramnani. I have been helping students succeed in the OET for the past year, and today I'm excited to share some valuable tips with you. Today video is all about OET Reading Part A, what it involves and how you can master it. So let's talk about OET reading. OET reading has three parts, part A, B and C. Part A is given for 15 minutes and part B and C has to be completed within 45 minutes. So let's talk about OET reading part A first. So part A has four text A, B, C and D, and has 20 questions which need to be completed within the 15 minutes. So for the question 1 to 7, you need to identify the information which is asked is present in text A, B, C or D. So from question 8 to 14, we have to answer by a word or a short phrase from one of the text. For example, what should be used to elevate a patient's fractured leg? We have to dig the answer from the one of the above text. So from 15 to 20 question, we have to fill in the blank with a word or short phrase from one of the above text. We have to find the answer in above text and fill in the blank here. So this was the journal introduction of OET reading part A, and now I'm going to give you some very useful tips which will help you to ace 20 out of 20 in reading OET. So my first tip will be to start your reading OET part A is to start from question number 8. Leave first 7 questions and start answering from question number 8. Why to do so? I will be explaining it in a while. So my second tip is to scan from text A to D just from their headings and subheadings, not to read the complete text, just to scan its heading and subheadings and try to remember that in your mind. So how to do it? Let's take an example and explain. So for example, our text is fracture, dislocation and sprain. Now in text 1, we can see that there are three definitions. There's a definition of fracture, dislocation and sprain. But we don't have to read all the definition. We just have to see that there are three definitions in the text A. And we have to remember the text A only contains the definition. Now the text B has heading called simple fracture of limbs, which I can see has three subheadings: immediate management, clinical assessment and management. Clinical assessment has several subheadings just as complete patient history, standard clinical observation, physical examination and check whether some checklist is there. Now I'm not reading all the text, I'm just looking headings and their subheadings. In the similar manner, text C has the heading of drug therapy protocol, in which the drug is used is called morphine, it's subcutaneous and IV route. Now the heading in text D is technique for plaster backslap for arm fracture, use same principle for leg fracture. Now this is the only heading which we have seen in text D. So these were all the headings and subheadings of reading part A. From 15 minutes, it will take hardly 2 minutes to scan these headings and subheadings. So let's go to our tip number 1, that is start question from question number 8, which is what should be used to elevate a patient's fractured leg. Now this won't be in text A because it contains only definition. It can be in B because the B has management part. So it can be there. C, morphine part, no it cannot be there. D, which is the plaster backslap, no it cannot be there too. So let's go in text. So in text B, there are three subheadings: immediate management, clinical assessment and the. So it cannot be in immediate management and clinical assessment. So it can be in the management part. We don't have to read all the management. We just have to look for the word elevate. Elevate the limb for a slinch for arm injuries and a pillow for leg injuries. So now we have got our answer. So it's a pillow for the leg injuries. So this is how we can find our answer by scanning. Let's do another question. What is the maximum dose of morphine per kg of a patient's weight that can be used through the intramuscular route. So it cannot be in A because it contained definition. It cannot be in B. The morphine was in part C. Yes, so let's go in part C. The trick in the question is that they are asking about per maximum dose per kg by the intramuscular route. So it is 0.1 to 0.2. Of course the maximum is 10 kg, but it's 10 milligram, but it's not up to the kgs. So regarding the kg, it is 0.2 milligram per kg, which is the maximum dose. So that is why our answer is 0.2 milligram per kg by the maximum. In the similar manner, after doing from question number 8 to 14, now we'll do question number 15, which is falling on an outstretched hand is a typical cause of blank of the elbow. Now, this filling the blanks, can it be in text A? It might be in the text A. Can it be in text B? No, it doesn't seem like it's been C. Or can it be in C in the morphine part? No. No, they're not asking about it, nor about the plaster or the backslap thing. Now in the text A, what I will find for? I will find for out a strange hand. So in fracture line I cannot find it, but in dislocation line, yes, I can see the out a strange hand. Now I will not read full complete text A. I will just read the line of the outer strange hand, which is the where a bone is completely displaced from the joint, and it often results from injuries away from the affected joint, elbow dislocation after falling on an outer strange hand. So our answer will be falling on an outer strange hand is a typical cause of dislocation of the elbow. Let's do question number 16. Upper limb fractures should be elevated by means of. Now here, will it be in text A, a definition? No. Can it be in text B? Yes, it can be in the management part. If C in morphine, no. In D, the backslap thing, no, it doesn't seem like that. So in the text B, I'm looking for the word elevate. Will it be in immediate management? No. Will it be in clinical assessment? No. In history or observation or the physical examination? No, it's in the management part. And there I can see that the word elevate and a syringe for the arm injuries. So for the upper injury part, the answer for question number 16 is upper limb fracture should be elevated by a means of. So our answer is yes, the syringe. So this is how we, that is the reason we do question 1 to 7 in the end, because we have gone through this paragraph many times. So now this become very piece of cake for us. For example, question number 1, procedure for delivering pain relief. Now the pain relief thing was in the part C, the morphine part. Then the second question, the procedure to follow when splinting a fractured limb. So the splinting thing is again here in the text D, the backslap text. Yes. And then the question number 3, what to record when assessing the patient? Of course, the recording part was in the clinical assessment thing. So it's text B. And question number 4, the terms used to describe different types of fracture is in the A, which is the definition part. The practitioner who administered analgesia is about the text C, again the morphine part. No, we have gone through this again and again and many times, so it becomes easy for us what to look for when and there's an injury. So it's in the text B. Of course, the observation part, how fracture can be caused, it is in the text A, the definition part. So yeah, so it becomes very peaceful. Thank you so much for watching. I would love to hear your feedback, so feel free to share it in the comments below. Do reach me out, and if you would like to see more videos of me on the OET, do let me know in the comment section as well. Thank you so much.